Sabrina. Baby. Okay. We're almost there.
Is that what you want? Huh? Is this what you want?
Sabrina.
Well, Daddy, don't film me while I want to eat my walnut.
How rude.
You know, seriously, I want to eat in peace.
Is it? What is it, Serena?
Shields up.
Hmm?
Shields up. Little protective tail.
Hey everyone. Sabrina just went to the back to get checked up on. I've got Serena. She had a nice visit with Shirley and Tim. And she's very happy to not be getting checked up on by Dr. Emerson today. You might be able to see how the fur around her teats are changed, and the fact that she now has teats when she didn't before. That's one obvious sign that she's now in heat, aside from the calling and other visual symptoms. But she's still a happy little girl, and we'll be excited to get home later tonight. I'll update you guys shortly. Thanks. Hey everyone, Sabrina's out of her exam and still asleep. And Dr. Emerson will be in shortly to talk with us. Look how peaceful she is. I love you, Sabrina.
On she's got, and I didn't see it before, it's on the other side and it's way back in. I went in, let me grab a piece of paper.
Okay. Sabrina, you're just full of surprises, huh?
I'm gonna come tomorrow and do. Okay, so when I was sectioning her out, hole that we're looking through to the other side, okay?
Okay.
If you look at that cartilage that's right in this area here, you'll notice that this is a little bit discolored and it doesn't have a lot of tissue on it. I'm worried that this is a piece of dead cartilage.
That's not the partially detached septum? That's something else?
It's just like the top part of it. I mean,
Okay.
you can look right in there and see it. So the septum is kind of this whole piece here, and we have a hole in it here.
Right.
This portion that's in the front, I don't like the way this tissue looks. It's a little discolored. And on the back side of that, which would be in the other nostril, there was some pus that came out of there. So then I looked through here into the other side, and back, way back in here, she has got this weird little blind pocket. So when I look through here, and you might be able to actually get magnifiers and look through there and see it, because I could see you doing that, and you might, with a good light, you can see it. But when I look through here, like at about that angle in the back, there is a hole that's in kind of the floor lateral wall of her nasal passage that has a track back there, and this was all full of like soupy yuck.
And that wasn't on the x-rays before?
I would never see this on x-rays because it's soft tissue.
Okay.
It won't, I'd have to have like a CT scan. But I've never noticed this before. And I had to suction away some mucousy debris, and I had to get a little bit of kind of like bloody stuff that was draining. Of course, after I'd gone in and done suction, it just triggers bleeding. So, because I've looked for cartilage, I've looked for dead anything, I've looked for necrotic tissue in there, but this bothers me because that is gonna, and I don't know where that leads to, but it's probably a blind pocket from when that tooth grew up in there. Everything got macerated and kind of pushed over. That's how she ended up with the hole there. And I am I guess it's probably from trauma. And it's just a scar. It actually it almost looks like you've got like a little bit of like a fibrous band across here that kind of really shouldn't be there, because there shouldn't be another opening in the floor of that nasal passage.
This is on the bad nostril?
No, this is on the good side. That's what I'm saying. This is over on her left side.
Okay, so the incisor that was going into her bad nostril also created another tunnel through the septum to the
Probably.
good side?
Probably what it did is when it came through, it just pushes all that tissue out of the way because there's like nothing left there. And her septum, when we started this whole thing, it was like all apart. You know, we had to go in and kind of like remake that whole thing in the front. But Brad, if you went, oh, I'm sorry, Sabrina, it's okay, baby girl, it's okay.
She's mad at you right now.
If you went and looked like at about my angle through the septum, through the hole that's there, and looked in on this side.
I've seen the hole in the septum, but I've never
looked past that.
So it actually leads to something.
Yeah.
Oh,
Well, it does. It should lead to an open nasal passage that has 2 folds in it. So I can't quite tell yet because I've got to actually get in there. And so I'm on the fence about what approach I want to use. I'm either going to want to go in over this way through the septum. I can't go through the nostril. It's just too small. Or I'm going to have to go in through the top, which I don't want to do. So my plan is, and I have to schedule this with time because I've got to tube her, and I've got to be really, really meticulous about it because I don't want to cause any more damage to what's there. I like what we have there, and I don't like that just this little piece of cartilage in the front looks unhealthy. So I may end up having to trim this so that our opening is then going to be kind of like this instead of this, like it is now.
By opening, are you referring to?
This dead piece of cartilage. I say dead. This unhealthy piece, I may end up having to take it out.
Okay.
So basically all I would be doing is, like right now we have an opening here. If I have to trim that piece, our opening would be bigger.
And that's the hole that connects the good nostril to the bad nostril?
Mm-hmm.
Okay.
This is the hole in the septum.
So it wouldn't affect her?
Nope.
Okay.
Not at all. But I'd like to give it, I see that tissue is growing all around that area, and I want to give it another week to grow in because I don't want to remove anything that doesn't have to go.
Okay.
But that little thing that's over here, this little track, that's got trapped yuck in it, and I'm wondering if part of this is what's maintaining our infection. Because when I went to go suction in the good side, I just went over here into the opening and kind of put the suction here, and I heard all this kind of noise coming from everything coming out of here, and I got this big plug of white chunk. Mm-hmm. I'm like, where in the hell did that come from? And so I looked in, and then I saw that this was open, and there was actually a little bit more stuff sitting in the opening of that. So I suctioned it out and cleaned it, but that can't be there. I've got to go in and get that open.
That makes a lot of sense for what I'm seeing. When I'm cleaning her out. I'm pulling it from her bad nostril, and as I'm tugging it, not really tugging it, but as it's coming along, it's coming from that area that you're...
Yeah, and I don't, further back or through in the very back side, I don't recall seeing any pass-through, but in the very, pass-through that shouldn't be there, in the very, very back, I'm a terrible artist.
Me too.
So if this were like the wall of the septum and, you have a nostril opening here and another one here. This is so not 3D. I'm sorry. That almost looks pornographic, and I'm very sorry. So if you came all the way back here in the very back, so the back of the, Oh my God, Brad, I'm actually drawing this out in my head, thinking about what it looks like. If this is the back wall of the sinus, this is the septum. There's a little opening here that's normal. Mm-hmm. And then you have, where the airflow and all that. You have one on the top and one on the bottom. That looks horrible. I am not doing this on purpose.
It's okay.
Oh my God. I'm covering that part up.
So when you say it's partially attached, you're only referring to the front? It's not partially attached in the back?
It's partially attached. So the attachment, actually, I misdrew this because it would be down here in the corner. Okay. There's a little opening. It's attached through here. Actually, it's more at the top like this. So okay. That's normal. But there is a natural opening between the two in the very back.
Okay.
And so when you have an infection in one side, you can surely have it in the other side. But this, if we went into this nostril this way, if this is one nostril, this is the other one, just separated, that track thing is here with this opening, and this is all tissue that's healed around here. There should not be like a tunnel in the floor of her nasal passage that was full of a plug of yucky mucus. So we're not there yet. And then I wanted to send the culture on my own accord. I put it in as a different animal because sometimes I never know what the lab techs are doing, and I question, like, do they look up the priors and see because they do check the requisitions and see that it's a repeat patient. I want an accurate culture. So I went into this with the culturette, got it bleeding and all angry. That's why you see bloody discharge on that side. Mm-hmm. And then I went all the way in the back and just twirled in there to reculture and get a good sample.
Do they give you...
I'll pay for that. I want to know on my own accord, like, what is it?
Oh, thank you. Do they give you information as far as, besides what's sensitive and not sensitive, do they give information on if this drug is sensitive towards the bacteria, this concentration is?
The MIC values,
okay.
They will. If I requested it for this one because I want that information, but I don't know. At the end of the day, the minimum inhibitory concentration, the MIC, almost all of our drugs are way more concentrated than the minimum because what the lab will do, if it's beyond the MIC, they'll give you a dose recommendation.
Okay.
Or they'll tell you, give this concentration if it's liquid. Or if I call them to tell them, you know what, I need to make a topical that goes in there, they'll give me a recipe for it based on the concentration of drug, based on the MIC.
So our next step is to
schedule her for next either Friday or Saturday, whatever day you want. Friday is are you working or can you?
I'm working, but I can work
Could you
around
get
it.
her here
Yeah.
like later in the afternoon on Friday, and I'll do like a late in the day?
Yeah.
I'd like to make her my last patient on Friday because I want to get in there, and then I don't know what approach I'm going to use.
What you said last patient of the day, is that going to give you enough time? Okay.
I'm gonna put her in at 3:00.
Okay.
We don't close until Friday 6.
Okay, that's fine.
I'll have plenty of time for it then.
Yeah, whenever you
I
want
just
to
want
see her, just let me
everything
know.
off my back when I go to do her. Like, I don't want to do her earlier in the day or on a different surgery day. Yeah. Plus, that'll give me time to get the culture in because I don't want to go do it until I know what's in the tissues.
Do you think it'll get there in time? Okay.
It'll go out Monday, and by Friday I'll have her prelim.
Okay.
For sure. If not a final.
I'm fine with that. Whatever you need, just...
Let's do it.
Okay.
I just need to get in there and figure it out because I did not see anything there before, but clearly there is a problem. And then I'm a little bit worried because I want to make sure that this track here doesn't, if I probe this, which I didn't do yet because I need her intubated to do it, I need to make sure that this is about here. I need to make sure that it doesn't open up somewhere back here, because then I've really got to get in there and go unravel that.
Did her bad nostril
It looks
sinuses
really
look
good.
Okay.
The only thing that I saw when I suctioned out is way up in that fold, and it's healthy tissue, but it keeps, because it's literally almost like pitched like this. It's really pinched up in the top. So normally you would have it like that, where you've got the wall of the tissue and then the top and then it comes around. But hers is really kind of pinched. It's almost like that, where it has like this kind of slit up in here. That, I mean, I had to go up in there actually with like a little metal ball to get it clean, because even just the suction alone, I'm like, why is it not coming out? So this is actually another area where I'm worried that she's trapping stuff. And
well, last time there was a chunk at the bottom of the incision area. Is that gone now?
I don't see anything there. And in the back of this, like when I look in her big nostril all the way back, this all is where I went and scraped out all that abnormal tissue. This is all healed up and it looks fantastic.
Okay. Yeah,
So,
I've been doing the holding her upside down thing. So
good. Were you? I was just gonna say, are you like getting her to where gravity is gonna fall that
She
stuff
looks
in
at me
there?
like, what is going on?
I feel like the infection is way down from what it was, but
yeah, like it looked great up until Thursday morning, and then Thursday morning there's just a couple.
And did anything change?
I ran out of Baytril today. Around that time, it started becoming more difficult to get the second syringe in.
You have her on Clavamox at all? Okay,
I'm doing
twice a day.
0.16, which is probably double what you recommended, but
That's okay.
she's had the Clavamox in her system for like half her life.
Well, no, that's why I want to reculture, because I want to make sure I'm not getting resistance. But Brad, if we have a pocket of anywhere in there, we're never going to clear it. I've got to get rid of that anatomy.
I agree. Yeah.
I got to figure out what. So my first step with her is going to be just to probe it and figure that part out, and then we'll go from there. But I'm going to have to go in there and do I'm either going to have to take nippers, and I have a tiny rigid scope that I can go up in there with, and I do have nippers that can go up in there as well. But that's one of those jobs where I have to like take a deep breath and just have everyone not talk to me.
Well, I'll make sure.
And I have to just go do my thing. So, anyway, Sabrina, I'm sorry. Oh, honey, I'm sorry. Oh, God, she hates me right now. Come here, baby girl.
I barely got her right now.
Come here, honey.
I was curious if she'd actually let another human hold her.
She does let me normally hold her. It's okay, baby girl.
It's okay. She is still wild.
Are you little Miss Squirrel?
Serena, like, well, practically,
Aww.
she's as social as Seymour.
All right, she's going to you.
I got her. If you can let go of her bottom nails, I got the rest of her. Okay.
She's good. Well, that's what I want to do. Let's just plan on that for next Friday.
Hi, Sabrina.
But we're doing okay. We just have another issue. And I think regardless of the last surgery, I would not do 2 openings at the same time, A, and B, I wouldn't have done a central opening to get to both sides. Because then I have to take basically the top of the septum off, and there's anatomy that runs right down the center, and I do not want to compromise that vasculature.
Yeah, I was curious at what it seems like you're against working on the septum. I wasn't sure
That's why.
Okay.
Because if I wreck the tissue and the blood supply going to it, here's a paper towel if you need it. Then we lose tissue that doesn't heal back, and so the middle is where the big stuff comes through, and I don't want to go and wreck it. And she's just pooping all over you.
She's a pooping machine. All right, everyone. Good job, baby. I love you. Good job. You covered it up really well, Sabrina. Where did it go? Good job. I love you. You ready to go to bed? It's been a long day, huh? I love you. Say thank you to everybody. Good night.